is if you return to sports too soon before your brain's fully healed, you're at risk of 4 things. First, just like if you have an ankle sprain that you go back to athletics too soon, you're at an increased risk of re-injuring that ankle. Well, if you have a concussion and you go back too soon, you're at an increased risk of getting another concussion. It tends to take less of an impact to do it. The symptoms are more severe oftentimes, and they tend to last longer, months instead of weeks. Next, we also know in people who get concussions, even if their symptoms are gone in 24 hours, even if they're gone in 3 or 4 hours, what we used to call getting your bell rung or getting dinged, we know that those folks, their brain is actually abnormal for close to a week, similar to when you get a cut on your skin and it forms a scab after a couple of days. Pressing that scab, it doesn't hurt anymore, but we all peel it off and it starts bleeding. Well, your skin takes a certain number of days to heal no matter what. Your brain's no different. So the issue there is potentially feeling back to normal and not being fully healed and going back to athletics, maybe not getting another concussion, but you're kind of picking at that scab, and then it delays recovery, making it take longer. The reason why we care a lot about that is because of the third risk of going back too soon. Most folks, 80 to 85%, are back doing everything out on the field, participating without any problems by a month. Those that aren't, though, those that continue to have symptoms beyond a month, are in what's called post-concussion syndrome territory. And for every week and for every month that you continue to have symptoms, it can become harder and harder to resolve those symptoms that you're having, and the risk can become higher and higher that whatever symptoms you're having, whether it's headache, whether it's physical signs and symptoms, cognitive, emotional, sleep disruption, that they can become permanent. Not that they will, but the longer you have them, the harder it is to get rid of them. And then the scariest risk of coming back too soon from a concussion is something called second impact syndrome. The good news is it's exceedingly rare. It's about 1.7 to 1.8 million sports-related concussions a year in the United States. 1 to 3 cases of second impact syndrome. So 1 in a million. Only happens in the 21 and under population, though. A still growing, developing, immature brain. The problem is if it's your kid or your athlete or your student who has a concussion and goes back to athletics too soon before their brain's fully healed, and they get another concussion before that brain is fully healed, and that brain rolls the dice and gets 1 in a million, and they get second impact syndrome. 50% of the time they die. 5, 10, 15 minutes right there on the field, or 100, and if they don't die, 100% of the time they're permanently disabled, not going back to school, not going to become president, things like that. And the idea there behind second impact syndrome is that operator inside your brain is in charge of a lot of things. One of the things is blood flow. So when you get a sprained ankle, a lot of blood goes down to your ankle to bring oxygen, nutrients, help it heal, and you get a swollen ankle, which isn't too much of a big deal because your skin can stretch around your ankle and accommodate that swelling. But that operator who's kind of woozy in a way because they're concussed and not making great decisions, if that brain gets hit again before that concussion's fully healed, that operator is going to say, oh, I've got another traumatic brain injury, I've got another concussion. It's going to ask for blood. And 1 in a million, sometimes it accidentally asks for too much blood, resulting in the brain to abnormally swell. And unfortunately, your brain can't swell because of your cranium, your skull that's around it. And that brain gets crushed, and those kids really don't do too well. Fortunately, it's exceedingly rare, and if they're getting seen in a concussion clinic and by appropriate physicians, we can prevent that from happening.